Welcome to our section on understanding coeliac disease. Coeliac disease is a common autoimmune disorder affecting about 1% of the global population. It arises from a complex interaction between genes and the environment, triggered by gluten ingestion in susceptible individuals. Gluten is a protein found in wheat, barley, and rye. When consumed by someone with coeliac disease, the immune system overreacts, causing inflammation and damage in the small intestine. Specifically, the tiny finger-like projections called villi that line the small intestine are attacked. The villi are responsible for absorbing nutrients from food, and their damage disrupts this vital process. Recognizing the symptoms and seeking appropriate medical attention can significantly improve the quality of life for individuals with this condition. With a gluten-free diet, people with coeliac disease can live healthy and fulfilling lives. Now, let's delve into types and symptoms in recognizing coeliac disease. Coeliac disease can manifest in various ways, making its diagnosis challenging. There are two main types: classic coeliac disease and non-classic coeliac disease. Classic coeliac disease typically presents with gastrointestinal symptoms such as diarrhea, abdominal pain, bloating, and weight loss. Non-classic coeliac disease may involve symptoms outside the digestive system, including fatigue, iron deficiency, anemia, dermatitis herpetiformis, and neurological problems. The absence of clear digestive symptoms often leads to delays in diagnosis. Coeliac disease can also be silent or asymptomatic, with individuals experiencing no noticeable symptoms despite intestinal damage. Diagnosis typically involves blood tests to detect specific antibodies and a biopsy of the small intestine to confirm the characteristic damage to the villi. Screening for coeliac disease in individuals with risk factors is essential. In our final section, we explore the causes or the roots of coeliac disease. Coeliac disease is a complex disorder with a multifactorial etiology. Both genetic predisposition and environmental factors play significant roles in its development. Individuals with certain genes, such as HLA-DQ2 and HLA-DQ8, are at increased risk of developing the disease. However, carrying these genes alone is not sufficient to cause coeliac disease. Environmental factors, particularly gluten exposure, are necessary triggers. When gluten is ingested and broken down, it produces a peptide called gliadin, which triggers an abnormal immune response in individuals with coeliac disease. Other environmental factors, such as viral infections and gut microbiota composition, are also thought to contribute to the development of coeliac disease. Section 4. Risk factors. Who is more likely to develop coeliac disease? Having a first-degree relative with coeliac disease substantially elevates the risk. Other autoimmune disorders, such as type 1 diabetes and Hashimoto's thyroiditis, are also associated with an increased likelihood of developing coeliac disease. Certain genetic syndromes, including Down syndrome and Turner syndrome, have a higher prevalence of coeliac disease. Individuals with IgA deficiency, an immune system disorder, are more susceptible to coeliac disease. IgA plays a crucial role in mucosal immunity, which protects the lining of the digestive system. Section 5. Prevention and precautions, navigating life with coeliac disease. Currently, there is no known way to prevent coeliac disease. However, early diagnosis and strict adherence to a gluten-free diet are crucial for managing the condition and preventing complications. A gluten-free diet involves completely eliminating wheat, barley, and rye from the diet. This requires careful attention to food labels and ingredient lists, as gluten can hide in unexpected places. Contamination is a concern, so it is crucial to avoid cross-contamination during food preparation and consumption. Individuals with coeliac disease should work closely with a registered dietitian to develop a well-balanced and nutritious gluten-free diet. With proper management, individuals with coeliac disease can lead healthy and fulfilling lives. Section 6. Conclusion. Empowering yourself with knowledge about coeliac disease. Coeliac disease is a complex autoimmune disorder that can significantly impact an individual's health and well-being. Understanding the basics of coeliac disease, including its types, causes, risk factors, and prevention strategies, is essential for early diagnosis and effective management. By avoiding gluten, individuals with coeliac disease can alleviate symptoms, prevent complications, and live healthy lives. Awareness, education, and ongoing research are crucial for improving the lives of individuals with coeliac disease.